I was 14 years old when my father was diagnosed with cardiomyopathy. We were told that a virus had attacked and destroyed his heart. He developed congestive heart failure and had many cardiac arrests. He spent most of the last 2 years of his life in the hospital. I was the youngest of 4 boys and the only one still at home. I remember my mother so clearly pleading with the cardiologist, "You must have something more up your sleeve. You can't tell me that there's no hope." His response, "Well, there's a heart transplant, but your husband is too old." He was 52. And they don't really work anyway. It was 1976. 11 years later, I was a surgical intern when I received a phone call that no one should get. It was from my sister-in-law. She told me that my brother, Rich, had just dropped dead while water skiing on a family vacation. He was 35 years old. I had his heart sent to our cardiac pathologist, and he confirmed cardiomyopathy. Another brother had it too, and at age 39, he received a heart transplant. I had the opportunity to hold both of my brothers' hearts in my hands in the pathology lab, which sounds kind of gruesome, but for me, it was an important part of coming to terms with the unimaginable tragedy that had befallen my family. I too had inherited the disease, and I was told that I was at high risk for a sudden death, and that I needed an implantable cardiac defibrillator, which had just recently been invented where I was training. I was the first surgeon in the world to receive a defibrillator. This bulky titanium device was so big that it had to be implanted inside my abdomen. And they had to open my chest and put 2 patches around my heart to deliver a shock if I went into an abnormal rhythm. That's my heart, by the way. And I walked around with all that junk inside of me for 30 years. I was told that this device and my disease was not compatible with being a surgeon, and that I should look for another profession outside of medicine. I was not willing to accept that. The kindness of a mentor allowed me to keep my surgery residency position while I took several years off of clinical surgery. I went to Oxford and received my PhD in molecular immunology. A few weeks after arriving in England, I heard a crash outside of my townhouse door. I ran outside, and there was a woman with a dreadful look on her face in an overturned car. She was screaming and crying about her baby, who was unconscious, upside down in a car seat. I climbed through the broken window, adrenaline pulsing through my body. My device went off 3 times as I was trying to extricate that child from the car seat. It was like getting hit in the chest with a sledgehammer. The hope that I had dared embrace about returning to surgery seemed shattered in those few minutes. How could I be an effective surgeon with such a disabling condition? The answer was that could never happen again, at least not at work. I had to completely retrain my mind and my body to extinguish the fight or flight reflex. I had to change the way I thought about everything. My own mortality, the approval of others, stressful conditions. I had to eliminate that voice inside my head that told me I was going to fail or I wasn't enough. As I slowly let go of fear and self-doubt, I got better at the things that I was doing. It's amazing how much we self-sabotage. My career as a surgeon unfolded, and I watched my field advance from something extraordinary to something almost routine. The drugs and the procedures got better. I performed several thousand transplants. Lives were transformed. Patients went back to near normal lives. I also became an important part of the process of creating hope for my family. By now, I was aware that my 3 biologic children had also inherited the disease. And this nightmare now spanned 4 generations. After my diagnosis, the next 30 years I would describe as periods of relative stability, punctuated by near-death experiences. At age 50, I had the first of 7 cardiac arrests. All could have been fatal. Some were reversed by my defibrillator, some were not, and required long periods of CPR by family members or bystanders. I spent a month in a coma in Patagonia. Now, I know some of you are probably thinking, why did you go back to Patagonia? When I was finally airlifted out, I emerged unable to walk, talk, eat, or speak. I had a cardiac arrest in another remote town in Italy. And as they rolled me into the emergency room, I was met by a priest who gave me the last rites. I thought at the time that that was overly pessimistic. Despite those many close calls, I wasn't considered to be sick enough to be prioritized for a heart transplant. Organs are allocated on the severity of illness, and there just aren't enough of them. Far less than 1% of the people who die every year die in a way where they could be organ donors. Only 3% of the people with organ failure receive a transplant every year. The others die waiting or become too sick to benefit from a transplant. My chances of surviving long enough to receive a heart seemed slim at best. With all the great advances that had occurred in transplantation, many of which I had been a part of, I found myself in the same predicament as my father 42 years before. Yes, transplants work now, but only if you were lucky enough to get one. My team had started a new protocol to try to make better use of the organs that were now becoming available as a result of the drug overdose epidemic. More Americans have died of drug overdoses since the year 2000 than soldiers in all of the wars combined since the American Revolution. A large percentage of those perfectly good organs were being discarded because they were infected with hepatitis C. There were now good drugs available that were extremely effective at eliminating the virus, but they had never been tried in a transplant patient who was receiving heavy immunosuppression. I became a subject in our own trial and purposely infected myself with hepatitis C by taking a heart from a heroin overdose victim who had hepatitis C. I took the medications for 2 months and I was cured. I did this because I believed in it. I was asking my patients to consider doing it, so why not me? Leaders lead. Also, by using an organ that would have been discarded, I wouldn't have to compete with one of our patients for a heart. As I recovered, I vowed to find another source of life-saving organs. I assembled an amazing team, starting with the team that had saved my life. And we set our eyes on solving the organ shortage. 3 years later, we performed the world's first pig-to-human xenotransplant. As a first step towards creating an unlimited, renewable source of organs so that no one would ever have to die waiting for someone else to die so that they could live. Thank you for listening to my story.